You and the primary care provider meet with Mr. Adams and discuss all the medication changes with him. Before leaving your office, he asks what can be done to reduce his risk for falls. You explain that you've addressed his increased risk through many of the changes today. For instance, changing his blood pressure medications should reduce his dizziness because of drops in blood pressure. Reducing and ultimately stopping clonazepam can reduce his confusion. Adjusting his diabetes medications can prevent drops in blood sugar. Adding vitamin D will help keep him balanced by improving bone, nerve, and muscle health. Seeing a physical therapist will help him improve his strength and balance. Having his vision checked and changing his footwear can reduce his chances of tripping. Getting up slowly at night, adding a nightlight, having a clear path to walk, and adding grab bars in the bathroom can reduce fall risks at home. Mr. Adams thanks you, and you encourage him to call if he has questions or concerns. You ask to see him again in 3 months. Working with patients and all their prescribers, you can coordinate care to keep older adults safe. The pharmacist's access to a complete medication history, knowledge and skills, and patient trust provides a unique opportunity to help coordinate care. To improve care coordination, use a team approach. Build trust and rapport with both patients and prescribers. Document your efforts and follow up so both the team and the patient understand the recommendations.
It takes more than one person to treat a patient. You need a team to be able to treat a patient. We're able to work with other healthcare providers, such as nurses, social workers, physicians, other pharmacists with specialties, and even speech language pathologists. We have so many different people on the healthcare team that we work with.
Collaborative relationships with providers are really important so that team members can work effectively together. I really like being able to work with providers on complicated patients, and what happens when you work with them is they start to learn maybe where your niche is and where your skill sets complement their skill sets, such that the team environment shows a much more effective patient care environment than if you were all working individually in your own offices.
We believe in developing a collaborative working relationship, and we found out there's certain factors that really can impact that. And one of those factors is your clinical competence, that they have to make sure that they feel comfortable with your competence if they're going to accept a recommendation. Another thing that we have learned is that trustworthiness becomes important as well too. That is, if I make a clinical recommendation and they say yes, go ahead and make the change, I better make sure I make that change and I do the ongoing monitoring and follow-up and provide that information back to the provider as well too. One of the important things to consider is really to document your activities. That documentation could be done on a chart, it could be done as a note, but they need to start documenting, because the old adage is if you didn't document, you didn't do it.
Some strategies I've used to enhance my relationship with prescribers include calling the prescriber, having face-to-face meetings with the prescriber, but then most importantly, not overwhelming the prescriber with your requests.
CDC and APhA developed a resource to help strengthen relationships between community pharmacists and physicians. It can be found in the resource section. It's been about 4 months since his discharge from the hospital, and Mr. Adams comes into the local pharmacy to pick up refills. As he walks up to the counter, you, as the community pharmacist, notice that he is walking with a cane. You quickly review the medication history to see if there are any medications that can be optimized or have recently changed. You notice that the clonazepam was stopped and the paroxetine dose was increased to 40 milligrams 2 months ago. You ask the technician to let Mr. Adams know that you would like to meet with him. You invite him to the semi-private consulting area to talk with him about his recent health history and medication changes. When speaking with you, Mr. Adams reports that he has not seen any improvement in his depression symptoms despite the new dose. Additionally, he has felt increased dizziness when standing. You check his blood pressure and review the postural hypotension brochure with him to help him understand what he is feeling and how he can manage his symptoms. Since you have established a strong relationship with his primary care provider, you plan to call the doctor to report the patient's symptoms and your recommendations.